it's the alarm clock. Kids are going to be heading back to school, and it's going to change how many deal with their schedules when it comes to sleeping and eating and other things as well. While school's a few weeks out, it is important to start preparing now for a healthy school year. Dr. Yun Boylston, a pediatrician in the Triad and member of the Cone Health medical and dental staff, is with us. So lots of families on that summertime sleep schedule, staying up late, staying in bed late. What should we be doing?
Great, and thank you for having me. That's such a great question for our families, and it's never too early to really start to plan out what a successful school year might look like for your kids. Surprisingly, good sleep routines don't start at nighttime. It actually starts in the morning. And so if your kids are sleeping until 10 or 11 a.m., it's really hard to impose that 9 o'clock bedtime. And so one tip would be start in the morning. So start setting your alarms for the times that your children will wake up during the school year. Make sure that they get good activity during the school day. That they cut out the naps if they've started to take naps during the day, and then certainly cutting out screens or digital devices at least an hour before the target bedtime, and that will probably help you really achieve your goals for nighttime routine.
That's really interesting to start with the alarm. Usually we're focused on get to bed early, but if you set the alarm at the time you're supposed to get up, you'll want to go to bed early for sure.
It's true, because the kids are going to say, I'm not tired, and it's true because they're not, right?
Okay. All right. So if if parents and families wait just until a couple of days before to make this big old change, what kind of impact could that have on your child?
Right. And, any advanced time or lead time to make preparations is helpful. But having that conversation, even with young children, what does having a good start to the school year look like to you? And talking about the benefits of what good nighttime sleep routines can have, that includes having great energy in the morning, being able to focus and bring your best self, not becoming hungry or hangry, during the middle of the day. And so these are the things that when the child is able to understand, oh, this isn't just imposing something on me, but this is really for my benefit so that I can be successful, they're much more likely to go along with it.
Okay. How much time, actually, how many hours of sleep should we be aiming for by the first day of school for like grade school students versus, middle schoolers versus teenagers?
Right. For age groups, that's different. And certainly for each child, they have unique needs. And so even for children who are the same age, some children, and the parents know this, if you have several children, who needs the most amount of sleep, other kids who can really be successful with less sleep. But as a general target for school age children, we recommend 10 to 12 hours a night. For older children or teenagers, really targeting 8 to 10 hours. And so when we say 8, that's typically the bare minimum that is good to function. Ideally, for most people, it's going to be more than that.
Okay, more than that 8 to 10 hours for sure.
Correct.
Yeah, you got to start putting those alarms on this week. Okay, children need to be up to date on their immunizations before they head to school. What if you're really not sure if your child is caught up because maybe you don't remember where the paperwork is?
That's such a great question. And parents, they're so well intended, but they're busy, frankly, and they have so much on their plate. The most reliable resource is contact your pediatrician. They keep records on everything, are more than happy to let you know, oh, your kid is up to date, have a great school year. Or it might be, hey, it might be time to schedule a well visit. We haven't had one in some time. Or you can have other questions like, hey, I need a sports form. So there are lots of things that are beneficial to contacting your pediatrician and seeing if they have any recommendations for your child.
Yeah, I feel like this is the type of summer where you start scheduling things and you start feeling the schedule get a little tighter. So some parents may say, well, I'm just going to delay the vaccine, or I'm going to delay the well child checkup. What's the danger in that?
Yeah, a well child visit, I like to describe it as something that's incredibly important, but maybe not urgent. And so it can kind of get on the back burner for families. But there's so many good things that happen during well visits. So making sure that your child is updated on their important vaccines and talking about health, how is your child growing? Are they are they growing through puberty in the way that we expect? What are the concerns about nutrition for your child? How is your child sleeping? What has changed in your family in terms of family health that might impact your child? So there's so many good, helpful things that can be discussed during a well visit. And so taking that time is really worthwhile, even though it is imposing on your schedules. I would say you're going to get a lot out of that visit.
And when it comes to the vaccines, there are some age groups that have to have the vaccine. They could actually be kicked out of school if they don't have a certain vaccine.
That's true. So in North Carolina, there are required vaccines to attend public schools. And we like to use that as an opportunity that, it's not just a requirement, but these are the ones that are very beneficial for your child and the ones with dire consequences should your child become sick. So a great example is the meningitis vaccine for teenagers. Meningitis can happen to you can be doing all the right things and in the right place, and sometimes illnesses can happen to people who are trying and not doing anything wrong. And so really it's about protecting your child from any of the things that we can, because we don't have a lot of certainty in life, but vaccine preventable illnesses are one of the things we can really move the needle on.
One thing kids face when they return back to school, kind of like the parents return as well, is stress. So let's talk about some steps that parents and caregivers can start taking now to maybe prevent some of that first week of school stress.
There are a lot of great things that families can do to prepare. I would say first and foremost, parents also have stress, and to acknowledge that and to talk to your children about, hey, things are going to change for us. We're moving outside of our summer routine into our school time routine. And how can we as a family work through this together and be successful? And making them really part of the team is important. And also to really acknowledge, stress and some element of anxiety. Those are very appropriate and normal, healthy feelings. And it's when they become out of proportion or create dysfunction in a kid's life where it's an issue. But going back to school and having that transition, that's an appropriate level of stress for any family, including children. And it's really, how do we best prepare you and to see it in the best light? How can we manage and overcome some of this so that we can have a very successful year?
Yeah, stress shows up differently in different age kids, whether that's your young kids or your teenagers, that kinds of thing. So let's talk about how they show up in our kids and maybe some do's and don'ts.
That's true. For children, stress can look really different from adults. So in younger children, they're not really going to articulate to you, hey, I'm really stressed out right now. It might be things like, I don't want to play. I don't want to go outside and ride my bike. My tummy hurts. So there are different ways that kids process some of those feelings. For older children, and particularly for teenagers, the mascot for anxiety is a porcupine. There's an uneasiness. It's hard to say the right things. It's just, are they uncomfortable? Are they irritable? And so, many people can be irritable and not be, not experience anxiety. But sometimes those are the kind of subtle signs that parents can look for.
Are there certain things that we should definitely do and certain things that we should definitely not do?
Oh, that's a great question. I would say one thing you don't want to do is dismiss it. So if you say you're fine, or I don't know why you're worried about that. Well, the truth is they are worried. And so as parents, we want to support them and help them work through that. And so sometimes simply validating, I know this is concerning for you, and I know this is a big change for you. Let's talk about it. What are the things that you're most afraid of? And so sometimes, in children, they kind of build things up in their head. And it's like, oh, well, let's talk about that. So we're going to go, you might not like your teacher. Well, we're going to go meet your teacher at open house. So let's see how that goes, right? And let's keep an open mind. And so kind of giving them the tools of, I validate that, and this is how we're going to work through it together, can be very reassuring for children.
Yeah, I think as parents, when we say, oh, you shouldn't worry about that, we're trying to give them peace of mind, but that is not peace of mind. That's good to note. Okay,
Right.
Kids are going to start bringing home those friendly little germs once school starts. So let's talk about reinforcing those good hygiene habits.
Yes. And that starts at home too, modeling good behaviors. And so things like, like we don't share drinks or food with other people, because a lot of germs are through sharing saliva or through coughing. And so we want to minimize that. But also having good etiquette when you are coughing. And, you don't always have to be sick to cough, but, using the vampire cough. So, that's when you cough into the crook of your elbow. And that's helpful. And I'm sure the teachers will appreciate that as well. Mm-hmm. And also, if you are sick or if your child has a fever, using your best judgment and keeping them home just to see how they're doing. And not all illnesses warrant a visit to the doctor. Sometimes it just takes parent judgment and a little bit of TLC at home, and they'll be fine in a couple of days.
All right, speaking of which, we have 30 seconds, so quickly, are there a couple of things we should have in our medicine cabinet for back to school?
Oh, absolutely. There are always some Tylenol or ibuprofen is always helpful. But for a lot of children, the things that help the most are not medicinal. So it might be keeping honey for cough for young children. A humidifier works wonders. And so those are things that, have no side effects, but can really go the extra mile in helping your child feel better.
Good points. Thank you so much for joining us with your time and expertise. If you missed any of this, or maybe you need to send it to someone, it's going to be in the 2-year well-being section of our website.